Hey, it's Jessica DeMassa with WTF Health. What's the future health? I am talking to the who's who of health tech and healthcare innovation in person this time at Health 2021. And joining me right now, I have Kelli Bravo. She is the Vice President of Healthcare and Life Sciences for Pega. Kelli, it's so great to have you here.
Jessica, so pleased to be here. Thanks for having me.
I'm excited to talk to you because you do a patient engagement survey annually, and you have for a number of years, and the most recent edition of this just came out. So I want to hear these statistics because what you're trying to do is figure out how patients want to be communicated with, what they like from a technology standpoint, all this stuff, asking them about the relationship with payers and providers. So tell me about this year's survey and what you've learned. Give us the highlights.
So this year is the third year we've run the survey, and what I found really impressive this year was that patients and providers came closer together.
Okay.
So traditionally, we've been an upward ramp that patients have been unhappy with the communication given to them by their providers and health systems.
No
and
surprise.
No, none. It's about 86% trending year over year. This year, it dropped down to 63%. I call it the COVID factor. I believe that patients are feeling a little unsettled, a little more concerned, and they are not willing to switch providers, where traditionally, they were happy to switch because they feel like they need a more personal experience.
Okay, so they hunkered down with their docs because of COVID. When did you do this survey so we get a sense of like where it was in this year? Because I mean, I feel like if anybody else, like 2021, it was a wild year. And so as we got the vaccine, I think people started to get a little bit more comfortable, and where we're at now is very different than where we were at the beginning of the year. So when did you do this survey and ask them?
So this year we did it in March, April, May.
Okay.
And the prior year we did it in February.
Okay.
And so we were just trying to make sure we had enough time to see that there was really a change.
Okay.
And there was a pretty big change. So from last year, before COVID really hit, 86%. This year down to 63%. We're really seeing patients step back a little. But I actually anticipate that next year the numbers will go right back up to the 80s because patients expect physicians, health systems, their payers, their pharma companies to know them, because nothing is more personal than health. And if we can't do a better job than the retailers, we're not doing what we need to do to engage our patients in their health.
All right, I'm going to come back to the retailers in a second, but one of the things that I thought was really fascinating about this survey, so you guys asked 2,000 people, right? Mm-hmm. And one of the things I thought was so interesting was the statistic about how their health plan and their provider communicate together and the information they're receiving. So it was like something like 27% said that the messaging from the provider and the plan were like in sync last year, and then this year that went up to 50, but still 50, not so great.
50, not so great. But what I think happened was this year they were synchronizing on COVID messaging.
Okay.
Where do I go to get my testing? Where do I go to get the results? What do I do? How do I get my benefits paid? So they were coming more in aligned. But you're right, 50% still failing in general. We need to do a lot better. And that really is the trigger behind why patients believe they need to make some choices. They don't feel like the health systems and their providers really know them and their families, and they're saying, look, we have the ability to change what we're doing to get better care.
What do you think on the technology side we can do to help that? You know what I mean? I cover digital health, I cover health tech. There's a lot of ways that people are using AI to help kind of refine their messaging or at least understand patients better, get the right messaging to the right place at the right time, you know, whatever that is. Like, I mean, talk to me about what your view on that. Like, how can technology help health systems and health plans communicate better with patients in the way that they want to be communicated with?
That's such a great question. So we're really focused on improving that engagement with patients. So it's the right channel, the right message in context, and very one-to-one and personalized. If you can't in real time expect and anticipate what a patient needs, you're sending them old information. If you're sending them something from yesterday and their circumstances change today, you don't really know them. You're not driving a great personal experience, and they expect that. They want their experiences to be better than the retail experiences because it's healthcare, right? We need to do better. We need to deliver a better experience. And technology today, certainly at Pega, we're very well versed to provide that service to our customers.
Yeah, and I want to come back then. You mentioned those retailers, so I'm going to dig in on this. So, I mean, like, do you think that at this point, I mean, and maybe you were seeing this in previous surveys that you had executed before COVID, this rise of the healthcare consumer, right? And as we're seeing, you know, Walmart and Amazon make their foray into healthcare again, but this time with a lot more success than previous times, do you think that that's starting to reverberate with patients and like they are starting to look at this like, hey, you know what? I do kind of expect this to be as easy as booking an Uber or as easy as finding an Airbnb or as easy as ordering something on Amazon.
Absolutely. I mean, they expect that experience. They expect you to come back, let's say, to the website and you remembered what they were looking for. If you're a diabetic, you expect information about diabetes, right? You don't want something else. And the retailers' experiences are really pushing the the healthcare companies to create a solution to the demand that's out there. And they're creating better digital experiences, better web self-service, better text, chat, all these different things now that you can do to get the information yourself. You think of digital consumer today, they want to be able to help themselves. They want to be able to get the answers they're looking for, and healthcare technology needs to rise to that occasion.
Do you think that the payers and the plans, the payers and the providers are able to rise to that challenge? Because that's a pretty big challenge. I mean, I feel like, in our space, we've been waiting for them to like jump on the bandwagon, and they're starting to make some investments. They're starting to do some integrations, but like at a broad scale, it's been slow going. What do you think?
It has been slow because the consumer hasn't demanded it. But now as we see these numbers rising up, we know that the consumer expects better, and now the technology is there. It's really up to these organizations to jump in with both feet and create the capabilities that makes it easier for that consumer to get what they need.
All right, so in addition to the patient engagement survey, give us a heads up on what's going on over there at Pega. You guys do a lot as far as this goes, so like give us a little bit of an update on what's new since COVID with Pega.
So we are really focused on healthcare providers, payers, pharma companies, enabling customer engagement, digital automation, using AI to create the personal experience we just talked about, really making it simple, getting rid of complexity, and allowing these organizations to drive better operating outcomes as well as, most importantly, better health outcomes.
Awesome. All right. No, this was so cool. So look at this. I've got some poker chips. Yeah, and I'm placing my bets, I guess, on this patient engagement survey coming out. One of them has the patient engagement survey. One of them has an invite to your conference. So promo the conference for us in case anybody wants to check out what you guys have put together, and then let us know where we can find the patient engagement survey results.
Happy to. So Pega World Inspire 2022 will be in Vegas this year in June. So we welcome you to come out. And our survey, just use the chip. You can get the URL on www.pega.com. You can download all the results about our patient engagement survey.
All right, that's fantastic. Kelli Bravo, the Vice President of Healthcare and Life Sciences at Pega. Thank you so much for joining us here. I'm Jessica DeMassa with WTF Health. For more interviews with the who's who of health tech and healthcare innovation, check out my YouTube channel over there at youtube.com/WTF Health. Thanks for joining us.
Thanks, Jessica.
Thank you.